6 signs and symptoms of pregnancy that you must know. For those who are trying to conceive, the sign of a missed period can give them hope and send them looking for a home pregnancy kit. Although a missed period is a good early indicator of pregnancy, it is not the first sign. As soon as you conceive, your hormones kick into gear and several changes start occurring in your body. However, most women don't recognize the signals their bodies are sending. By paying attention to what your body is telling you, it will be easier for you to detect pregnancy at the earliest stage. It will help you know when to see your doctor for a pregnancy test and plan things accordingly. Here are the top 6 early signs of pregnancy. 1. A missed period. Missing a period is one of the early possible signs of pregnancy that most women are aware of. For a woman who is in her childbearing years and not using birth control measures, a period that is late by at least a week can indicate pregnancy. However, as no birth control measures are 100% effective, a missed period should not be taken lightly. In some cases, there may be a small amount of bleeding at the time of menstruation. This happens when the fertilized egg implants itself in the wall of your uterus. This kind of spotting or bleeding is usually harmless. Apart from pregnancy, other reasons that can lead to missed periods include diet changes, excessive stress, fluctuations in body weight, hormonal changes in the body, and some kind of illness. If your period is late or absent, the only way to be sure of your pregnancy is to take a pregnancy test. It is recommended to opt for a test 2 to 10 days after your cycle is normally due. 2. Frequent urination. As the bladder starts reacting to body changes caused by a new pregnancy, you may also need to visit the bathroom more frequently even though you may not have increased your fluid intake. The increased volume of blood during pregnancy is filtered by the kidneys, making the bladder become full more quickly and resulting in more urination. At the same time, you may be more thirsty than usual. Increased frequency of urination is common in all stages of pregnancy. As the uterus wall expands to allow the baby to develop and grow, it reduces the amount of space for the bladder. This creates pressure on the bladder and makes you rush to the bathroom more often. Always see a doctor if you experience any burning or stinging sensations during urination. 3. Nausea. Another common symptom associated with early pregnancy is morning sickness. According to the American Congress of Obstetrics and Gynecology, nausea and vomiting affect 70 to 85% of pregnant women. This queasiness and throwing up can strike at any time of the day or night. This problem may start as early as 2 weeks after conception. The nausea feeling will go away by the beginning of the 2nd trimester. Again, you can blame your hormones for the nausea. Along with hormones, folic acid deficiency may trigger nausea during pregnancy. For some women, morning sickness occurs only a month or 2 after conception, and some lucky ones do not experience it at all throughout their pregnancy. To fight nausea, eat something starchy first thing in the morning and stick to easy to digest foods. Also, drink water frequently to stay hydrated. 4. Tender breasts. Once you have conceived, the first symptom to show up is swollen, heavier and tender breasts. The breasts become sensitive and swollen due to changes in the levels of the hormones estrogen and progesterone. It's similar to how your breasts feel before your period. Tenderness in the breasts can be experienced as early as 1 week after conception. The discomfort diminishes significantly after the 1st trimester. Until then, the best way to relieve soreness is to wear a solid, supportive bra. In some cases, the nipples become more protruding than usual. Also, the areolas may appear darker and spotted. Breast tenderness also occurs during ovulation and right around the time of menstruation. 5. Increased sensitivity to smell. Pregnancy can make you more sensitive to smells. In fact, increased sensitivity to smell is one of the signs that women notice before they even realize they're pregnant. The ongoing hormonal changes in the estrogen level in the body affect the olfactory system, which makes expectant mothers more sensitive and reactive to the scents around them. This heightened sense of smell to certain scents or foods can lead to food cravings and aversions. It can cause morning sickness or a metallic taste in the mouth. If you suddenly find yourself disliking the smell of your favorite food or you are becoming aware of more smells around you, then you may have conceived. 6. Fatigue and tiredness. As soon as you conceive, your body goes through a lot of changes. The rising level of progesterone makes you tire more easily, leaving you feeling fatigued and exhausted frequently. Lower blood pressure and blood sugar level during pregnancy can also make you feel very tired. At the same time, the body is creating the placenta, the vital life support system for the fetus. This takes up all your energy and causes you to feel tired. Fatigue is most common in the first and third trimesters. This early sign is easy to miss, as new mothers often relate it to normal fatigue. If you are feeling tired all of a sudden even though you got plenty of sleep, and you are experiencing some of the other symptoms mentioned here, opt for a pregnancy test. If it comes back positive, get plenty of rest and eat foods rich in proteins as well as iron. Five signs and symptoms of ovarian cancer every woman should know. Ovarian cancer primarily affects women 50 years of age and older. It can occur in several parts of the ovaries, which are located on either side of the uterus. Although ovarian cancer accounts for only about 3% of cancers affecting women, it causes more deaths than other cancers affecting the female reproductive system, according to American Cancer Society, ACS. People often ignore the warning signs of ovarian cancer until the problem becomes severe. It is important to be aware of these signs, as addressing the problem early can save you from future complications. If you have multiple signs and symptoms of this problem, ask your doctor to check your health levels. Here are the early warning signs of ovarian cancer. 1. Pelvic or abdominal pain. The growth of a tumor in an ovary causes pelvic or abdominal pain. The tumor exerts pressure on and around the surrounding areas, leading to intense pain. In cases of ovarian cancer, the pain persists for weeks. If you are 50 years of age or older and experience pain in the lower abdomen and pelvic area, consult a doctor for a pelvic exam. Younger women should also see a doctor when experiencing pelvic pain outside of a monthly menstrual cycle. It may be a sign of a benign ovarian cyst. Ovarian cancer is rare during a woman's childbearing years. 2. Uncomfortable or painful intercourse. Painful intercourse, medically known as dyspareunia, is another early indication of ovarian cancer. The presence of a tumor in or around the area surrounding an ovary can make intercourse extremely painful. There may even be mild vaginal bleeding after the intercourse. Usually, this kind of discomfort is new for a woman. Women who are postmenopausal and experience painful intercourse must get checked by a doctor. Apart from ovarian cancer, it may indicate cervical cancer or an infection or sexually transmitted disease, STD. 3. Abdominal bloating or swelling. General discomfort in the lower abdomen may also indicate that something is wrong with your ovaries. Symptoms like bloating, expansion of your belly, gas, indigestion, heartburn and nausea are common. In a 2008 study published in BJOG, an international journal of obstetrics and gynecology, most of the women suffering from ovarian cancer complained about persistent abdominal distension and fluctuating distension or discomfort, which they frequently called bloating. If you are 50 years of age or older, your clothes suddenly start feeling tighter around your waist and hips and it lasts for more than a couple of weeks, you need to see a doctor. 4. Frequent or urgent need to urinate. Sudden changes in urinary habits can also be a symptom of ovarian cancer. There may be changes in the frequency of urination, loss of bladder control, incontinence, or spotting blood with urine. Urinary changes most likely originate due to the pressure from the tumor or from fluid in the abdomen prompted by the presence of the tumor. A 2004 study by Olmsted Medical Center and Mayo Clinic analyzed the symptoms of 107 ovarian cancer patients. Abdominal pain and urinary urgency were the most common symptoms in women who had stage I-II ovarian cancer. For many women, these changes may also be a sign of weak pelvic floor muscles or a urinary tract infection. No matter what the reason, it is always best to consult a doctor.